So a lot of you have probably not gotten to this flat cardiovascular model. I'm going to go over as much as I can, but know that I may forget some things, so definitely go back and look at it again. Starting up at the head here, we know we have the superficial temporal artery. Now we're missing the muscles, so it's not as superficial as it should be. If I go down to where the heart is, I'm going to start with these great vessels here. So we've got the superior vena cava right here, and it's going to have branches here that are draining into it. Those are the brachiocephalic veins. Draining into that is the subclavian vein. Looking at the arteries that are right next to it, you've got the aorta right here. This is the arch of the aorta. Here is your brachiocephalic trunk, followed by your left common carotid artery and your left subclavian artery. Now, if you follow that left common carotid artery, you'll notice it's going to go up along the neck. If you follow subclavian, you'll notice it's going to the upper limb. Now, up here, we have got the internal jugular vein. One thing that's not great about this model is it's making it a little confusing what's going on with the jugular vein here. So just remember, internal jugular vein is going to go up into the cranium. External jugular vein is going to release all these branches right here. So if we go back down to our heart here and along to the lungs, you'll notice there's the pulmonary trunk here and then the pulmonary arteries coming from it. So notice that they're blue and not red, even though I said they're arteries. They are colored that way because of a difference in oxygenation. So don't let that confuse you. Just follow it from the pulmonary trunk and you'll know those are pulmonary arteries. And then the red ones, of course, are pulmonary veins. Notice we're also getting a real nice view of that pulmonary semilunar valve here, and then peeking out right in here is the aortic semilunar valve. I'm going to go into the upper limb before we get moving into the rest of the body. So remember, we've got the subclavian artery moving into the arm. So this one is the left subclavian artery. Now, once we pass under the clavicle, which is going to be roughly about here, we're going to get into the axillary artery. Notice it's the same vessel, but we get a name change. So it's going to be the axillary artery until we get down to the inferior border of the teres major muscle. Now, of course, there are no muscles on this model, but you can kind of imagine it's going to be somewhere in here. So axillary down to the brachial artery. And then this is not the anatomically correct side. So I'll get into the forearm in a little bit here. I first wanted to mention that here we've got the posterior humeral circumflex artery as well. Now, if I move over to the other side, so this is the anatomically correct side. We're going to follow that brachial artery down, and notice that we're getting right here a split. So we're getting the ulnar artery, because we're on the ulnar side here, the pinky side, and here we're getting the radial artery on the radial side. This one right here in the middle is the anterior interosseous artery. And then there are some other ones here. We have got right here, this branch coming off of brachial, that's an ulnar collateral artery. And then this branch here is a radial collateral artery. So just to make that clear, we've got subclavian artery, axillary artery, brachial artery, ulnar collateral, radial collateral. Then we get into the radial artery, going up here, the ulnar artery, and the anterior interosseous artery. And notice that both radial and ulnar are going to contribute to this structure, which is the superficial palmar arch with the digital arteries emanating from it. So those are our upper limb arteries. We of course have veins there too. So let me just briefly walk you through some of the veins. If you remember, we had the subclavian vein over here. So we go from superior vena cava to the brachiocephalic vein, not brachiocephalic trunk. There's the subclavian vein. And then we're going to get a split here. So this one right here, that's going to be on, if you raised your arms, so if we move this guy's arm and raised it there, this would be more on the head side. This is called the cephalic vein. And the reason I mention the head is because cephalic means head. Now over here, we've got a couple veins here. So we've got cephalic. This is going to be, sorry, we're going, where do I want to be here? This one right here is the, you know, just like you guys forget names, I'm blanking right now. This is the cephalic, and why am I blanking on this? You know what, we'll edit that back in.
We will.
Basilic. It's basilic. See, you all got to see that in real time, me trying to remember the name of something. So we got the cephalic vein, we got the basilic vein, we've got subclavian vein, we go into the axillary vein, and then this little branch right here, you can barely see it, that's going to become the brachial vein. Now going down, we get the median cubital vein right here. So that's our upper limb. I'm going to move now into the abdomen. There's quite a lot to see in here, so we'll cover some of it. Here is the aorta again, and the inferior vena cava. And just to orient you to these organs, these are both kidneys. This is the spleen, this is the liver. So we have right here the celiac trunk being represented. It's got 3 branches coming from it. The branch on top is the left gastric artery. The branch on the left going towards the spleen is the appropriately named splenic artery. And then the one on the right is the common hepatic artery. Now, as for our veins here, we've got 2 renal veins going towards the kidney. So renal means kidney. There's a whole lot more complicated stuff going on in here that I think for now we'll just skip. I got more into the portal system in that duodenum, pancreas, and spleen model. So if you haven't watched that video, I would suggest looking there for some of this region. This little dot right here, which you can't feel this, but it is actually raised, that's the superior mesenteric artery. Right down here, this little nubbin is the inferior mesenteric artery. And then we have a paired set here that are the gonadal arteries. So if we're looking at an individual who has ovaries, they're ovarian arteries. If the individual has testes, they are testicular arteries. We can then see the split that happens here from the aorta as well as from the inferior vena cava. So we've got the common iliac arteries that then split into external iliac and internal iliac. And then the same is going to happen with the veins. We've got the common iliac veins, external iliac veins, internal iliac veins. Now moving down, so external iliac artery, once it passes under the inguinal ligaments, somewhere around here, it's going to become the femoral artery. So we can follow the femoral artery down. Once that moves posteriorly, about right here, it's going to pass through the adductor hiatus, and we're going to get a name change to the popliteal artery. So we're popliteal artery up until right here. There's a branch here that you can follow anteriorly and to the top of the foot. That is the anterior tibial artery. The part that's going to continue posteriorly down to the bottom of the foot is the posterior tibial artery. And this little branch here is the fibular artery. Now, going back up just a bit, so we're going to crawl back up that femoral artery. We get right here the lateral femoral circumflex artery. So it's got a branch going inferiorly, and then a branch that's going to loop around our femur right there. This is the deep fibular artery, or profunda femoris. And you can also see that on the other side. So here is that circumflex artery. And then the deep is a little harder to see on this side, but it is right down here. We've got more at the knee region here. These are called the genicular arteries. So those are going to provide blood flow around your knees. Pretty important. And then if we follow this anterior tibial artery inferiorly, we're going to get down to this little structure whose name I am blanking on right now. You know, you guys know this is my last video, right? We'll write that in there. But we've got a couple. Oh, it's the arcuate artery. Kate is filming. She reminded me of this. Yes, this is the anterior tibial artery leading into the arcuate artery. But in between about where the tibia ends here and where that arcuate artery starts, it's called dorsalis pedis. So remember, this is the top of the foot. I also want to alert you to the fact that just like on the nerve flat model, this left side here for both the leg and the arm are not in anatomical position. So as you're studying, keep that patterning in mind. So this was our last model of the day, guys. We tried our best. Let us know if you have any questions.